It's a major dereliction of public duty. It's shameful, to be honest, that politicians have put point scoring before fixing this issue.
Andy Burnham says he wants to fix adult social care in England and has floated again the idea of a national care service. But what exactly does he think has gone wrong, and what could these fixes be? We'll discuss on this episode of Newscast. Hello, it's Adam in the Newscast studio, and we're going to focus this whole episode on the thorny issue of adult social care in England. Although there are knock-on effects, because social care has to be delivered, well, in every country in the world. And so I've assembled three of my great colleagues to help me understand what Andy Burnham was saying at his speech today at a social care facility run by a Jewish charity in North London. Please welcome back to the Newscast studio, BBC Social Affairs Editor, Alison Holt. Hi, Alison.
Hello.
And you've been covering social care, and I mean this respectfully.
A very long time,
yeah.
yes.
How many years do you think you've had on this beat now?
I don't even dare count it, but I will say I interviewed Andy Burnham in 2009 when he was launching his plan for a national care service.
The first time round.
The first time round.
Yeah.
So I do feel I've been here.
And of course, the point about that was he was announcing it too late in the lifetime of that Labour government. Yeah. It was never going to happen because there was an election less than a year away.
Exactly. So his plan was to put a £20,000 levy on people's estates after they died to fund a national care service. That in the general election became dubbed a death tax.
By the Conservatives.
And in a sense, it also started this real political football, which I'm sure we'll get into, which went on for years, death tax, dementia tax, death tax, etc.
Yeah, and also famously, Ken Barlow from Coronation Street did an advert for the Conservatives about the so-called death tax in that election.
You do have a good memory.
I mean, it's quite a famous moment of British electoral history, so I'm not going right into the archives there. Also joining us, Ben Chu from BBC Verify. Hello, Ben.
Hello, Adam.
And Jim Reed, our health correspondent, is here too. Hello, Jim.
Hey, Adam.
Right. So, Ben, you've been looking at some numbers and also a bit of political history as well. Yeah?
Mm-hmm. Yeah, that's right.
And Jim, you've just got quite a lot of experience of the things that have been going wrong in the system thus far.
Yeah, I've been speaking to families today reacting to the announcement. And every time you speak to any family that's caught up in this, honestly, your heart just goes out to them because they've often been through the absolute ringer. And it does bring back just how many people are affected by this. There's some statistic that I think it's pretty much everyone in the country knows someone or has had to deal with these kind of issues, yet they are not talked about perhaps as much as they should be.
Although, Alison, will come on to the details, if we call them details, of Andy Burnham's speech today. But that whole idea of the pain that families go through, the hard work it is for the workers, and how terrible it is for the people who need the care a lot of the time, was a big feature of this speech from Andy Burnham, wasn't it?
Yes.
Also talking about his own life.
Absolutely. He referred to his father who has Alzheimer's and, praised the staff. There was one lovely phrase where he talked about the way they communicated with him, brought out the essence of his dad. And so he was celebrating that, but also talking about the difficulties and the horror of navigating this system. And like Jim, I've spoken to so many families who they arrive at this point of a crisis in their family's life because it might be a younger person with a disability or it might be an older person with dementia or who needs help. And they're confronted by a confusing system. Often they think it's the NHS will help them, but it doesn't because it's about personal care, help with day-to-day living.
Yeah,
and
if you were diagnosed with
it.
cancer, you'd be put on a very clear pathway about what care you'd get from the NHS for that. But with social care, it's a total minefield.
No, you have to go to your local council quite often. You'll be means tested. If you have more than £23,250 in assets, income and savings, then you get no help at all. If you have less than that, then you will get some help, but you'll still pay charges. A lot of people still pay charges. And there is a general sense of unfairness amongst the people you speak to. They say, we've paid taxes for years and here we are, and we are really struggling and we are worried about the future.
And Jim, one of the other things that Andy Burnham majored on today was the knock-on effects on the NHS. And so echoing one of the things he said to Laura in her interview over the weekend about the risks to the NHS of not solving this.
Yeah, there's a stat, and I'm sure Ben will come on and talk about this. Every day in England, roughly 13,000 people are in a hospital bed that don't need to be there. And that's why some of these conversations, I think, about money are so difficult, because you're trying to weigh up the direct cost of potentially bringing in these policies with the indirect cost of sort of not bringing them in, and therefore the knock-on effects on the health service. And that's why some of these calculations are just so difficult, I think, for the media, the public, for politicians to get their head around.
Give us some of the numbers then, Ben. What's a good way of making a spreadsheet out of
here's a
this?
way of thinking about it. So in England, because we're talking about the English system at the moment, we spend roughly £30 billion a year of public money on social care. So that's about 1% of the economy. And that's been rising quite rapidly over the past 15, 20 years as the population has got older and as need has gone up. But it's not been rising fast enough to meet the need that's out there. So that's why there's so much, as Alison and Jim have been saying, pressure on the system, so much of a sense of it's underfunded and it's unfair. So that's a key number to bear in mind. Then you've got, what do we spend on the health system in England? And that's about £200 billion. So it's much, much more we spend on health than social care. So those are the two. And the argument is, if you spend more on social care, you'll reduce some of those bills on the overall health budget as well. So it's estimated by the King's Fund, this health think tank, that those stats that Jim was talking about are costing the NHS in England about £2.7 billion every year, because you can't discharge those people into the system, even though they're clinically fit, because of the dysfunction of the social care system. So potentially you invest more in social care, you'll reduce that overall bill. So that's something to bear in mind. Some other things to bear in mind is, how much is it actually going to cost to do some of the reforms that have been floated?
Yeah, I think we'll come on to that next, because it is a big spreadsheet. But let's dive into what Andy Burnham was actually saying. We've set the context really well there, I think. So he gave a sort of numbered list, which I always love when a politician helps you with taking your notes and then holding them to account later. And number one on the list was getting Baroness Casey to do her existing review into reforming social care, but doing it a year earlier. And here is what Andy Burnham said about that.
Social care is different. It has to be person-centred. If it's not person-centred, like the brilliant care provided here at Jewish Care, then it won't be what people would recognise as social care. You don't want to over-medicalise care, but it has to be very integrated with the rest of the system. It has to be preventative in its character. It has to be person-centred. And that's what we're asking Louise to give us her report on. How do we deliver a national care service in England that sits alongside the National Health Service, works in a similar way, that is highly integrated and can optimise the journey of a patient. If a patient's leaving home to hospital, back as quickly as possible, and there's no delay.
Now, Alison, just on that bit of jargon, person-centred care, I'd covered that as a concept for years, and I didn't really know what it meant, because I just thought, hang on, it's a doctor, a nurse, a care worker, they're caring for you. How can it not be person-centred? Until I saw an example of somebody I know suffering from a really serious condition, and actually they were treated by sort of 10 different people who did their bit of the job rather than focusing on the person that needed the help. Is that what person-centred care is trying to avoid, trying to solve?
It's trying to look at what that individual needs. And that's a really good example about, rather than having 10 different people asking the same story over and over again.
And doing their own little bit.
Doing their own little bit, but not joining those bits up. That's if you avoid that, you have more person-centred care. But the other bit of it is actually finding out what helps that person. It might, if it's a long-term condition, it might not be about something medical or something medical or health related. It might be simply trying to get them involved in a club so they're not so lonely. It might be making sure that they can get out into their garden so they can enjoy that. It's looking at what makes that person feel better and helping them do that, so that, the argument is and the evidence is that improves people's lives.
And also, Jim, back to the NHS point that the PM was making, he said, well, actually, quite often you have a care worker who can't solve the problem of the person they're looking after at that point. So they call 999, and then that person is whisked away in an ambulance and they're into the hospital system, which could be a terrible place for them to be to solve that initial problem.
Yeah, I thought that was a really important part of the speech, actually, when he started talking about that. I mean, we cover these subjects all the time in the BBC Health Unit, And often you go into hospitals and you go to frailty wards in particular, and they are full of people that really want to go home. And there's some statistic, as soon as you've been in a hospital for more than a week or so, actually the time it takes you to leave hospital starts growing almost exponentially. So the idea behind all this, and this is the kind of thing that we've talked about so many times before, is to avoid people going into hospital in the first place through some of the stuff that Alison was just talking about, but also through things like community care. And Andy Burnham was talking about how the number of community nurses has been cut quite dramatically across England over the last 10, 15 years. Now, these are all the kind of they're not the sexy bits of the NHS, they're not cancer care, these are not brain surgery, but these might be the bits that actually can cut the amount we're spending on the health service by a significant amount if we can refocus the system properly.
One example that has often been given to me by care staff of how good social care can work. It's a really sort of down to earth thing. They say that if an older person has a good level of social care, they get to know their care worker. If they develop some sort of infection, like a urinary tract infection, a UTI, which is very common, that care worker is more likely to pick it up. They might just take their temperature and then ring the GP and say, I'm a bit worried here. What should we do? And then the GP can prescribe antibiotics or whatever is appropriate. Therefore, that person doesn't end up in hospital. If it's left untreated, then the danger is that they become more confused, that they fall, and then something that is relatively small turns into an emergency.
And we'll come on to the social care workforce, the people who are noticing those things in a second. But Ben, just on that timing point about Louise Casey's review. So if I remember correctly, I had a long conversation with her when we did our episode at Hay Festival, an episode that people can listen to again on Sounds. So she was going to do a sort of evidence review, initial sort of scoping thing that I was thinking was going to come out about now, and then she would do her final recommendations in 2028. So it sounds like maybe we won't get the initial thing at all, but she will do the final thing a year early.
Yeah, so Labour obviously came in promising to scope out a national care service, and then Keir Starmer last year said Louise Casey was going to do it with that initial report back in 2026 this year, but the final thing not before 2028. So that was widely perceived as being kicked into the long grass, effectively, because it was so controversial and potentially expensive. So what Andy Burnham has announced today is that he's going to bring the final report to 2027. He said this time next year, which is actually a little bit later than he initially suggested in a Guardian interview before he was PM. He wanted to do it. He suggested,
so quicker but slower.
Yes, at the same time, he suggested he wanted the final thing back by the end of this year. So he's had to bow to reality a little bit there. Maybe Louise Casey has told him it's not feasible to do the whole thing by then. But he's definitely accelerated the timetable, and the feeling is you need to get it going if you're going to produce something and act on it before the next general election.
And Alison, just on this big branding, I mean, I don't mean that in a derogatory way, but of a national care service, that's one of those things where you can sort of kind of instinctively imagine what it is, but then you start to think about how that is implemented and how it's run and who runs it and what it is, and then it gets a little bit kind of murkier.
Well, I would say it's a phrase that has been used by lots of different people to mean lots of different things. I don't know if you remember, I think it was during COVID.
The badges
appeared.
Yeah.
And
that was Matt
National
Hancock.
Care Service.
Yeah, Matt Hancock didn't have anything to announce one day at a COVID press conference, so he came out wearing a badge saying care and said, I want the care workers to be taken as seriously as nurses. Yeah.
So it can mean an awful lot of things. We haven't had any detail on what the Prime Minister thinks a future care service should look like. I mean, in the past, he has talked about free at the point of use in a similar way to the NHS, but that can actually mean a lot of different things. I mean, Scotland provides free personal care, but there are limits to the amount of money and it's generally a complicated system, but you could have a much more generous system, which Ben will know will cost a huge amount more. In the end, there are a set of choices which politicians need to make, and some of those decisions will be shaped by the amount of money they believe that we want to spend.
Yeah, and we'll do the money in a second. But Jim, I was intrigued in the Burnham speech that rather than talking about some of those things that Alison was mentioning there, like free at the point of use, delivered on NHS principles, he was talking about a national care service as an organisation that could sort of plug into the National Health Service like they were two Lego bricks.
Yeah, use that phrase integrated.
Yeah.
quite a lot. I think
Other construction toys are available.
it's interesting. It feels to me that what they are thinking about doing here, reading between the lines, is maybe not having the money, the funding, the resources that they'd like at the start of this process. So bringing in things in a more of a kind of staggered way. So what you might see to begin with, maybe in this parliament, is some stuff around care home staff and the way they're funded and the way they're paid. And that might perhaps end up in a situation like Alison was talking about there, where we have free personal care like in Scotland, but with this kind of ultimate ambition to do something perhaps more ambitious in the longer term. Now, looking at the public finances, and I'm sure Ben can talk about this better than me, it feels unlikely they're going to have time to do that in the short term. But there does seem to be a bigger ambition here than just repeating the policies that are in place in Scotland.
Well, to repeat my excellent Lego analogy, I'm not trying to get any freebies here. So basically the NHS is like, those big green square base plates that you get. And then the National Care Service will be built up by different coloured bricks that get added on to the green base plates. Anyway, let's leave that metaphor behind. And Ben, Andy Burnham talked about there's a full-on way of doing this, there's a medium fat way of doing this, and there's a minimum fat way of doing this. He didn't use that phrase, but what are we talking about there in terms of prices?
Yeah, well, I think you can think about it in terms of, are you trying to cap the costs for any individual in the system, which was broadly what the Dilnot report, remember in 2011, Andrew Dilnot, the economist who was asked to look into that, his approach was to say, let's try and cap the costs that any individual has to face. And he's put a low cost, actually, pretty low, 35,000. So no one will have to spend more than that on their care. So that's one way of doing it.
And that's what Boris Johnson was going to do, but with a higher cap.
At a higher cap of £86,000. So accepting the principle, but putting in a higher cap. Another way is to increase the means test threshold. So people do get state-funded support, but only, as Alison was saying, if their means are below around £23,500. You could raise that significantly so more people get the benefit of the state-funded support to maybe £100,000. Again, that's what Boris Johnson planned to do. That's what Theresa May planned to do. And that's what Dilnot proposed. So that's another way. And then you could go, well, let's just say what people get for free. So go down the Scottish route, for example, and say people get free personal care, or say really ambitious, a national care service. So basically it's like the NHS, free at the point of use. Now, full credit to the Health Foundation, because they've done some kind of really good costings of these proposals. They estimate to do the cap on what people have to pay over the lifetime of £86,000 would cost in today's money around an extra £4 billion a year. So this is on top of that £30 billion I mentioned earlier. So it costs a bit of money. It's not revolutionary. That may be the kind of organic thing that the government could do. To do the Scottish system, free personal care guarantee, they estimate in England that would cost another £7.5 billion a year in total spending. And to go full-on NHS-style care system, that's really quite significant. That's about £18.5 billion, according to the Health Foundation's calculations, extra a year on top of the £30 billion. So they're the kind of ballpark figures. We don't know what Casey will recommend or what Burnham will pick up, but that gives you a sense of the extra spending involved.
And Alison, this is a really hard question for you to answer, so I apologise in advance, but putting together all the clues. So Louise Casey has said quite a lot about what she's trying to achieve. The Prime Minister has said quite a lot today and has said quite a lot in the past. Which of those many options we were just brainstorming there seems like the most likely one? Or have they not given away any clues about that?
So I spoke to Louise Casey this morning, and she was saying that first off, she thinks that there are a lot of efficiencies within the system, getting rid of that duplication that we've talked about between the NHS and social care. So I think she thinks that relatively quickly you can start to see a difference. As to the big picture, I wouldn't want to bet on any one of them, because what they've also launched today is what they're calling the big conversation on care, where they want to tap into the values that drive us as a society and what we feel is right in terms of what we should be providing people with who need social care, and also what are the trade-offs, how much are we prepared to pay. And they seem to be putting a lot of weight on that, both in terms of shaping reforms, but I would also say in terms of putting pressure on the politicians to, knocking their heads together effectively and saying, come on, you've got to agree a solution. Because if you do have a clear idea of what we as a society think, then in theory that should push politicians to a solution.
And we can talk about the politics in a second, but just in terms of the trade-offs, I suppose the trade-offs that have always existed in this conversation since I've been covering it is, do you have a situation that provides certainty for every single person, but is funded a bit by everyone who might not experience those circumstances? Or do you leave people to deal with it with their own resources? Or do you have a mixture of the two where the state steps in once you've lost all your resources, or to prevent you losing all your resources?
Yeah, I think
it's basically, do you pay for everything or do you pay for a bit?
Well, what you've kind of described, the second option, is what we kind of have at the moment, because the state does step in, but only when you've got used up most of your money. So there is state support, and it's relatively significant in terms of the overall cost, but it's not enough. It doesn't meet people's expectations. So in terms of what Alison's saying in the big conversation, we do need to decide as a nation what we think is fair. And then we need to decide how we are going to fund it and how we think it's a fair way to fund it as well. So this is why it's founded attempts over the past 20, 15 years, is because we've not got that clear as a society, as a country, on those issues. And until we do, we can't move on. Really.
Because Labour wanted it to be a form of inheritance tax, and the Tories said, oh no, we want it to be a cap on the cost so that no one faces catastrophic costs, but you probably will have to pay something. That's been the dividing line. Jim, we spent ages talking about point one, which is about the Casey review and what he wants her to look at. Point two was about the social care workforce, so the people who are actually delivering it. And so much of that boils down to the whole 15 minutes appointments thing.
Yeah, he talks about that in quite a lot of depth. I thought it was quite interesting that he spent the first bit of that speech talking about how a lot of the care that he'd experienced either personally or through speaking to people was very, very good. And he kept paying, almost patting staff on the back and saying you're doing a great job, and then went on to the problems afterwards. I think that was deliberate. I think there's this idea that, social care is the kind of thing you go into work for if you have to. It's very lowly paid, it's very lowly skilled, and he wants to get out of that kind of bit of the conversation. So he talks about that in quite a lot of detail. There is this review going on anyway, which should report back in 2028, what's called a fair pay agreement with people working in social care. So what he's kind of talking about today is kind of bolstering that, or suggesting that can be bolstered up. So that could end up in a situation where there is better qualifications, better standards, and essentially better pay for people working in that sector. Because the idea is if you increase pay for people working on the front line, then you're not going to have all these staffing shortages. And when you speak to people working in care homes, people running care homes, that comes up often as the number one problem which they're having to deal with, not getting enough well qualified staff.
Yeah, I think it's crucial. A lot of people work in care because they're passionate about it. They've often had personal experience, perhaps caring for a family member, and that has made them want to give more. So they don't do it for the pay. But increasingly they are being asked to do more and more complex things that might once have been done by a district nurse even. But the pay doesn't reflect that. And one of the things that quite often happens is that someone will start climbing the ladder of qualifications, and then they'll go to the NHS, because at the NHS they will get paid several £1,000s a year more for what is virtually the same job, and they will also have a pension. They'll have it will be a salary rather than 0 hours. They'll have the sort of sustainable working life that we all need to live our own lives.
And it's also basic things. I just remember hearing a piece on the Today programme about carers not being paid for the car journey from house to house, even though they're still on the clock and they're still working, and just what a drain that is to know that that's how you're employed. Yeah,
and one of the reasons for that can be the way in which they're commissioned, the way in which that care is bought by local authorities. They don't all do this, but some will just pay for the time in front of the client. And well, what happens when you're getting from A to B? And if that's not factored in, you're pay is very, very low.
It is worth bearing in mind, Adam, that the way that the care is delivered in terms of, as Alison was saying, local authorities commissioning these private independent providers to provide it is very different from the NHS system, obviously, where it's sort of a state-run system. You can imagine, though, the cost implications of putting care workers on a similar status to NHS workers in terms of their ability to push for higher pay. Now, that may well be a sensible thing to do in the long term to keep costs down for all the reasons we've been discussing. But you can imagine concerns in the Treasury of putting this permanent workforce in a kind of putting them on a par with NHS workers in terms of the costs there. So I've been talking about the costs of kind of delivering it in the current system to do a complete overhaul. And as I say, put them on a par with NHS workers, the cost will be even higher. And it is worth saying, if they do go for those more expensive options, it's very hard to see how they can deliver that without putting up taxes. And that will be a political consideration.
When again, to compare the care workforce to the NHS, you can imagine a world where the care workforce, which is now one thing, goes on strike over pay like resident doctors and nurses and consultants have done.
Yeah, the delivery mechanism that they have at the moment has been a way for the Treasury to keep the costs down. Now, you can say that's bad or that's good for various reasons, but losing that mechanism will be a concern for the Treasury for sure.
One of the things the Prime Minister announced today was that there is going to be a ministerial committee that I get the impression is there to drive through change. It will include the Health Secretary, Housing Secretary, but also John Healey, the Chancellor, which is really interesting because talk to anyone who's been involved in past plans for social care reform and they say you have to get the Treasury on board if you actually want to make change. So again, I think that's quite an interesting indicator that you know, they're tying the Treasury in at that very early stage.
Well, and that just reminds me of when I was the chief political correspondent and doing the Tory version of this every single day and trying to get my head around it at 5 o'clock in the morning. And yeah, I mean, they did get the Treasury in on board that time, but it involved a quite large increase to national insurance contributions, which they called the Health and Social Care Levy. But there was a whole argument about the fact that it would go to the NHS for the first few years, and then gradually the amount the NHS got would go down, and then the care system, it would gradually go up.
And it's worth thinking about the history of that, because what happened to it, it was cancelled by Liz Truss and eventually Rishi Sunak. And their explicit argument was, this isn't the time to be raising taxes. So you're going to run up against that same argument. Putting up taxes is going to make the economy less progressive. It's unfair on people to pay more in taxes. It's going to hold back economic growth. So Burnham, if he does want to fund this through a tax rise, will have to deal with all those objections.
And if you look at the comparison with the NHS again, the NHS recently announced in England a 10-year workforce plan. So you've got long-term planning. You don't have that for social care at the moment. I think that's one of the things when you talk to people who run care homes, they would really like to see a bit more long-term planning. But also, it's interesting how that subject butts up against other bits of government policy, not least immigration policy. A lot of people working in care homes come from overseas. There's lots of pressure on migration and kind of cutting that number down as well. So
people say the health and social care visa was abused.
Exactly. These are not easy questions for the government to deal with in isolation.
Point 3 that Andy Burnham made, and we've spent about 2 hours on the first 2 points, so let's do this one quite quickly. It was the cross-party talks that he wants. Alison, you hinted at that earlier on. Here is Andy Burnham answering your question, Alison, about how those cross-party talks will go better than previous cross-party talks.
If I look back to that experience that I had as Health Secretary in the 2005 to 2010 Parliament, we probably left the reform too late in that Parliament, and it got too close to a general election. And learning from that, that's why I'm bringing forward, one of the reasons why I'm bringing forward Louise's review, because I think it's better to do it sooner and further away from an election. And that answers another story for the media, doesn't it? That there's no election on the horizon. I think it's best to deal with it early and to listen, because often what we can do is then drop a solution out late. Engage now. Don't have cross-party talks when a solution is emerging, again, which is what we did back then. Build it with people. So do it now. Get people in now and start talking, understanding the different perspectives. I don't know whether it's possible to find agreement, but let's give it a try.
But where they've ended up is Ed Davey, the Lib Dem leader, zooming in from his holiday, Kemi Badenoch, the Tory leader, not going and sending Stuart Andrew, the shadow health spokesperson, and the Greens and Reform not invited at all because they don't count as the two main opposition parties in Parliament.
Yes, it doesn't bode particularly well. But I mean, Andy Burnham on the inviting the Conservatives and the Lib Dems said that they had asked for a discussion with him. So, well, let's see what comes out of it. I mean, I think political agreement is important, but in the end, we have had attempts at cross-party talks before.
Even quite recently.
Quite recently, also, the last decade, we've had a lot of cross-party talks. In the end, it's about the action at the end of it. And there is not that much time. I mean, by the time Louise Casey delivers her report next summer, there will be under 2 years to the next general election.
And as we know in politics, summer stretches out to sometimes November when they want to do things slowly.
I think there's a real danger that we will end up tight against the next general election, or too tight against the next general election. But there is also, this has gone on for a long time. It is having an impact on the NHS. More importantly, it is having an impact on a huge number of people's lives. So at some point we do have to, forgive the cliche, but grasp the nettle and do something.
And Ben, the Tories have already named their price for agreeing to any solution. They say no tax rises and no extra borrowing to pay for it.
Yeah, well, given the numbers we've talked about, that's going to be almost impossible to square, isn't it? If Andy Burnham wants to do anything which is comprehensive and ambitious.
Well, unless the Tories would say you cut the welfare bill quite a lot and then you could pay for it with that.
Yeah, well, that would be their argument.
Yeah.
I think it is worth saying cross-party talks is one thing, but intra-party talks, because there's been a lot of disagreement within parties about how to deal with this. So David Cameron had a plan which Theresa May tore up, saying the Deal Not plan was unfair. Boris Johnson had a plan and that was scrapped by Rishi Sunak and Liz Truss because it raised taxes. So it's very, very difficult to even get agreement within a single political party, let alone across 3, 4, 5 parties on how to approach this.
Alison, just another question that came up at the PM's event today. Sam Coates from Sky pushing him for a position on assisted dying. And here is what Andy Burnham said.
My position on assisted dying. I take the view that that debate, and I don't say that there shouldn't be a debate at some point about those issues. Personally, I think there's something that needs to happen first, and that's the fixing of the funding of palliative care and social care. I think it is very challenging to introduce that wider debate in a context of people not receiving that care and having the peace of mind about that care.
Right, so that's Andy Burnham clearly thinking on his feet there. Jim and Alison, think on your feet now. What have we gleaned from that answer, if anything?
I thought it was really interesting that he was tying that big issue that as a society we are wrestling with into improving social care and palliative care. And if it's certainly one of the strong arguments that has been made is that if you get that care better, if you improve it, make it easier to navigate, then people will not feel a burden as, obviously they're not a burden, but it will make it easier to it will encourage people not to go for assisted dying. But I'm afraid I haven't got any deep thoughts on that.
No, don't worry. That sounded pretty deep to me. I mean, if that was shallow, I'm impressed. Jim.
Yeah, I think the flip side, in a way, of what Alison's saying, and this is the argument that people use, is that if you have poor palliative care, you might end up in a situation where people are pushed into choosing assisted dying when they don't need to. And this is an argument which has been used very much last year through all the debates. I thought that the answering on his feet thing, I think, is a really important point, because it did feel like he was literally not making up that answer, but you could hear the kind of the cogs working as he was saying it. And he's a very inexperienced prime minister, let's be honest here. I wonder if how that comment is going to play out when we get into September and potentially a new backbench bill that goes through the whole process all over again. He did say there should be a debate. So he certainly wasn't ruling out that coming forward, but he certainly
Is a debate the same as legislation?
And he did not seem particularly keen, did he? I think is a fair way of saying it on that idea.
And rather than being neutral on it, he sounded like he was opposed. Whereas previously the government, the Prime Minister would have been neutral.
The other thing I thought was really interesting is when he brought up the US healthcare system, and he said that social care in the UK or in England at the moment is as unfair as the US health system. And I kind of looked up when he was saying that. I think that is quite a bold statement to make when you think about the media narrative in this country, and people think about the US system as failing. An interesting comparison, I thought.
Well, we could do a whole other podcast doing that essay question. Alison, last question to you. And there's so much commentary about Andy Burnham's comms and his delivery and his demeanour and what he's wearing that day, and whether it's the appropriate dress code for meeting a foreign leader at an aircraft carrier. There was an interesting moment at this event today, wasn't there? I'm not clear what was actually going on there with the notes, no notes thing.
I didn't see any notes at all.
Because basically, does he not say, I've got a script, but I'm going to throw it away?
He did. He started off by saying that. As I say, I didn't notice any notes sitting there, but perhaps, I could have missed that. It certainly felt like he was speaking from the heart on this one. Towards the end, I felt like he was slightly teary in terms of, he was saying, I might fail, but I'm really going to try. And he was talking about his father, and you can see how personal it is to him.
I just think on that point, though, he was so fluent and interesting and compelling today. And whether you agree or disagree with what he thinks and what he's doing, the performance was quite compelling. Just think back to what Laura was saying at the weekend on Newscast. I'm sure you all listened to that episode. Where she was saying Andy Burnham supporters see a slight risk that then the days where he has to stick very religiously to the scripts because he's talking about Ukraine or something to do with the finances and it could move the bond market, it'll just become glaringly obvious that that's not the real Andy Burnham that day.
But now is the time to do it, isn't there? When impressions are being formed of him to pull out all the stops. And I'm sure a lot of it was rehearsed, like a lot of the lines you can tell. And he had a lot of information in there. It was very fluent, as you say, performance. And he made a structured, coherent argument that lasted, 15 minutes?
Yeah, about 15 minutes.
So difficult.
And it does hit all the bits of the press release that went out in advance.
So few of us, I imagine, are good enough and fluent enough to produce, without having thought it through very carefully, that point. So I'm sure there was practice and there was thought that went behind it, whether or not there were scripts.
I mean, Alison, you've done a fairly good job of that here right now. So thank you very much.
So kind.
Ben, thanks to you too.
Thank you, Adam.
And Jim, good to see you as well.
Thanks, Sam.